We're going to talk about the ReShape Balloon, which is something new that we're offering with our practice. We're trying to be a very comprehensive practice, and this sort of is a piece that fits in nicely for a patient group that really wasn't getting much attention when we looked at the stratification of all our patients. So it's really designed for the group that isn't quite where the surgery patients are, but needs more help than the patients who are just a few pounds overweight. And they do have medical issues at the weight this device is designed for, and I think it's very good that we now have something to help and help cure that problem. This is the statement in the FDA approval paper, and it's for people who have a body mass index between 30 and 40 and one or more obesity-related comorbid condition. Well, I can tell you pretty much everybody has at least one or more associated comorbid condition. It doesn't have to be diabetes. It can be joint pain, it can be sleep apnea, it can be depression. All those things are related to weight. So, and it needs to be used in conjunction with diet and exercise. That's the FDA's recommendation. And that's because the efficacy is probably better when we start to combine everything. So who cannot have the balloon? Well, if your BMI is less than 30, you don't meet the FDA cutoffs. So we would be using it off-label, and therefore, right now we're not going to be offering it for people with less than a BMI of 30. If you've had previous abdominal surgery, particularly if you had gastric surgery, stomach surgery, and particularly if you've had a previous weight loss operation, they do not recommend placement of the balloon. And that's because they don't want it to get trapped in a portion of the stomach or turn it around or twist it or what have you. If you have active ulcer disease, the balloon is rubbing on the wall of the stomach, and that could potentiate that. So that would be a contraindication. And then chronic inflammatory disease like Crohn's disease, which can flare up in the stomach, are probably a contraindication. What you don't see on here is a patient with a BMI over 40. So that's sort of a gray zone right now. The FDA did not approve it for that, but I don't see a downside risk-wise for offering it to a patient with a body mass index over 40, provided that patient either does not qualify for surgery or does not want to go through the risk of an operation. So I think if a person's heavy and they don't have another option and they don't want to do surgery, that this should probably be a viable option, and we'll talk about that on an individual basis.